welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Dava Gerald. She is a surgeon and she is a surveyor for the Joint Commission. And she wrote the Kevin MD article, 4 Steps to Convincing Healthcare Colleagues to Get Vaccinated. Dava, welcome to the show.
Well, I thank you very much. I appreciate that.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Well, I started out actually wanting to be a surgeon and didn't find out I had to be a physician first until I was in high school, and that added another 8 years or so to my life. Became a surgeon at a time when I was the first woman surgeon in my training program. Practiced in South Orange County, had a very unexpected leadership experience in the 1980s or so, which led me to really a passion for physician leadership. That ultimately culminated in me becoming very active when the breast cancer world was just beginning to wake up, and took a prominent role in that, that led me into leading cancer programs, both academic and community, and doing an executive MPH at UCLA. And that led me into surveying for the American College of Surgeons, Commission on Cancer, and National Accreditation Program for Breast Centers. As I did that and went around the United States, surveying both large and small programs, it became very apparent to me what a major role safety in healthcare was providing. And that allowed me to transition to the Joint Commission, where I've been the last year and a half. And it's been a whirlwind ride to learning about the complexity of healthcare and the devil in the details. And merging that with my physician leadership passion. And so it's very exciting to me when I was surveying in my very early survey days. We were a number of surveyors, probably 5 or 6 of us in a room, including our life safety engineer. And we're fed up with wearing masks. And so I said, okay, everybody's vaccinated in this room, right? And the life safety engineer said, no, I'm not vaccinated. And frankly, it shocked me. This was a life safety engineer. But I was also curious. So why did you, in fact, not get vaccinated? This was probably May or so when those in healthcare, and we were in hospitals, every week, hadn't gotten vaccinated. And he said, well, I really haven't had time to look at the pros and cons of vaccination. And he was a person with some comorbidities. And so we had a chat about that. But it led me to think about, in healthcare, are there other physicians? And then, of course, we saw there are some politician physicians who are not surveyed and are very vocal about that. And what could we do as physicians? So it's not just the scalpel we use or the laparoscope or the prescription pad or the orders we write to influence healthcare for our patients and for each other. So that's kind of my story of how I came to write this article and to think about this problem, which is not that different if you think about it, to how did we first encourage women to get screening mammograms. That was a very similar challenge that we faced early on and continue to some extent to face.
So let's jump into that article. You wrote it back in May, like you said. It's titled 4 Steps to Convincing Healthcare Colleagues to Get Vaccinated. And as you said, healthcare workers getting vaccinated continues to be an issue now that we're speaking towards the end of July. In fact, I'm looking at today's New York Times, and the title of this headline is More Hospitals Are Requiring Workers to Get COVID Vaccines Because Some Healthcare Workers Are Still Refusing to be immunized. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and, of course, share the story of why you decided to write it?
So, as I looked at it and reflected on my experience with screening mammography, the first thing we really needed to do was, rather than just telling people to get a mammogram or sharing numbers, was to understand what was preventing them through talking with them. And at that time, we came up with a whole host of what we call myths, which were actually kind of interesting. And some of them were culturally specific or age specific. And we could generalize from that. And so my thought was first to talk with our colleagues to understand why, first to understand rather than jumping in and saying, okay, you really do need to get vaccinated, or throwing numbers at them, to really meet them where they were, which is, a guideline for so many other things that we do in life, and what is really holding them back. And then to discuss that. So, first I looked at thinking about doing a qualitative study, really based upon, what are the factors holding you back from getting vaccinated, so that then we could talk about the pros and cons in a way that was meaningful to them.
Mm-hmm. Mm-hmm.
So then the next step, as I thought about it, was, physicians as well as many other healthcare workers we're time starved in terms of education or learning, other than maybe flipping on the TV. How can we create specific messages that address the most common reasons why healthcare workers or physicians are not getting vaccinated? And how can we do that in a way that is easy
Mm-hmm.
and convenient and in many locations? And then I've always had the belief, especially for physicians, you want to combine the numbers with the story.
Mm-hmm.
And, I think all of us have some sort of story related to COVID, even if it's that I don't like wearing a mask. To the other end of the spectrum, where, I lost my parents to COVID, and having them talk about that. So educational modules that are combine both that qualitative sense, the stories stay in people's minds. Unquestionably, that's what our brain is triggered for. The numbers will take care of our scientific, side of our brain that will help bolster that. The other thought I had, and I'm smiling now because I remembered doing this when I was collecting Red Cross money in the 6th grade. I was the Red Cross monitor, and I would put on the blackboard everybody that had contributed. And that was a response. What I really wanted to do was put everybody's name who hadn't contributed.
Mm-hmm.
But I recognized the power of peer pressure.
Mm-hmm.
And certainly in organizations that are departmental, to create a friendly competition. It is in many of the healthcare environments where you have formal, departments of medicine, pediatrics, surgery, whatever. What's the first group that makes it to 100%? Where are the other ones? And you even de-identified, putting up numbers,
Mm-hmm.
how many are we still requiring, to put a little peer pressure on the, on the area. And then to have some reward to becoming vaccinated beyond the obvious long-term reward of you're highly unlikely to die from COVID and unlikely to even experience COVID. And that's especially now with the Delta variant being so transmissible, is back in play again.
Mm-hmm.
And so, the more lenient rules for those who are vaccinated, and I would say that I'm in the ballpark of mandatory vaccination. I mean, when I think about it, what things should be freedom, and you should be very liberal, and what things should be rule-based. So, for example, we all need a driver's license to drive a car.
Mm-hmm.
If you're, not trained and you can't perform well, you're a danger. You're even a danger sometimes when you have a license. But nobody disputes that you should have a license. So to me, it's very odd that we should now have such a debate about having our liberties taken away from us by being required to be vaccinated, whether it's working in healthcare or kids going to school, which is another topic that's in the news quite a bit recently, that it seems to me there are certain circumstances when you are putting other people at risk
Hmm.
that the societal need takes precedence. That's my own personal feeling about this. But certainly, the physician should be in the lead role. That separation of public health from clinical care is not in either discipline's best interest. We do know, for example, in the 20th century, the major opportunities that we took to advance life expectancy really were in the public health field.
Hmm.
They were, having sewage, having clean water, and then later the vaccinations that were available. They weren't in any particular drug that we dispensed. And so public health should be more robustly presented within, I think, within the curriculum of, physicians or other healthcare providers.
One of the most powerful points that resonated with me is understanding and empathizing with the motivations of those who are hesitant or refuse vaccines. Now, when you ask healthcare workers about some of these motivations, what are some examples of answers that you receive?
It's usually I'm too busy, or it is, well, long term, there might be some effects we don't know about yet. These vague answers that give me the gut level feeling that maybe it's more politics
Hmm.
than it is actually science, and reminding folks that what we do is evidence based, it's science. We've bought into that as a profession. We believe that. And to kind of make this exception is there's a dissonance with that. So, I want others to get vaccinated, but not me or not my family. Or, the other people get the disease, or, I'm not old.
Hmm.
That initial thought, well, I'm healthy. We used to hear that in breast cancer. Well, I'm very healthy. Nobody in my family had breast cancer, so I'm not going to get it. Well, in breast cancer world, only 10 to 15% of breast cancers are inherited. So I often hear, well, I'm really very healthy. Well, we know very healthy people have also died from COVID, and that very healthy people have also often transmitted it to their families, their friends, etc. But those are the most common comments I have. But it's challenge for, at least for me, it's challenging to be able to ask that question empathetically rather than to point a finger and say you're a bad person.
Hmm.
um, and so I really work on my head first when I ask that question to understand that these folks have a belief and to maybe show them where their belief is dissonant with some of their other beliefs, I found to be helpful.
Now, as you mentioned, and as we both know, we live in a very polarized society where it's very difficult to change one's minds, especially since the vaccine has been politicized. Now, short of mandating the vaccine, do you expect us to move the needle using some of these efforts?
I think if it was work related and mandated, there's the opportunity, but a general wide mandating, I think we're past that stage of being able to have done that. I think early on, given different political situation, that would have been possible.
Do you expect these tactics to realistically move the needle and convince healthcare workers to receive the vaccine?
I can remember, for example, I was working in Memphis, in
Hmm.
Tennessee, in a community that, is tobacco related. And all of the hospitals got together and said, together, we're all going to determine that we're going to be non-smoking. Because we knew if it was one or the other, the patient would just go to the other hospital. And so I think this is not, in some ways, unlike that, where if all the hospitals together decided, this is what we would expect. There's the opportunity to do that. Do I think it's going to happen? I don't think so. If we get to be too, I'll use the word nice about it, that lets folks off the hook. Folks who are sharing the disease with other people lets them off the hook. But to bring to their attention, they wouldn't really want to be responsible for someone else getting, I'm sure of, and to relieve some of their concerns. But, hearing, well, it's just an emergency authorization, that, again, I felt from a physician standpoint, or scientist standpoint, we understand what that really means and the data that's already there.
We're talking to Dava Gerald. She's a surgeon and she's a physician surveyor for the Joint Commission. She wrote the Kevin MD article, 4 Steps to Convincing Healthcare Colleagues to Get Vaccinated. Dave, I want to switch to another topic. So a lot of people have preconceived notions about the Joint Commission. So you have a platform here. What is the biggest misconception of the Joint Commission and what can you do to dispel that myth?
Okay, I think the biggest misconception is that we're the bad guys, that we're there to castigate organizations. There was a very deep change in the culture when it went from JACO to the Joint Commission. We are collaborative. All of us all of the surveyors the clinical surveyors have had significant clinical experience. They've also had leadership experience, and we want to educate and we want to collaborate. And what we bring, I look at it as it's like a treasure hunt for us, where if we can find something that can be corrected before someone is hurt by that, it's really like a gift, which is what I used to tell when I was leading an organization. I used to tell folks, but we're collaborative and educational, and we've all been on the other side. And we enjoy what we do. We know how important it is, and we work hard to help folks relax when they talk with us.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
My take-home message really is those of us in healthcare really need to be an example to the rest of the community, and that we have a responsibility to do that.
Dava, thank you so much for sharing your time and insight. And thanks again for being on the show.
Sure. Thank you very much.